Past 8 now. Dr. Majid Fotuhi is here, and he is the author of The Memory Cure, How to Protect Your Brain Against Memory Loss and Alzheimer's Disease, and you're also a neurology consultant at Johns Hopkins.
Yes, thank you very much for having me here.
Oh, it's a pleasure to have you here. It's funny that we're talking memory right now because we were talking about that hot list before,
yes,
and talking about Rita Hayworth, and I could not remember for the life of me the movie. It's Gilda. But my memory, I think most people, it kind of slips in and out, comes and goes.
And that's quite normal. A lot of people have that, and that's just perfectly normal.
It is.
Yes.
Because I know a lot of people say or worry, thinking as their memory starts to, if it declines as you get older, it's like, well, and they think that may be some kind of precursor to Alzheimer's disease. They're not linked.
No. So some degree of forgetfulness is quite normal as you grow older. It is true that you're more forgetful when you're in your 50s than when you're 40s. But that doesn't mean that you have to worry about it. People who have serious memory loss, they forget, for example, that they saw a movie at all, or that the name of their children. They forget big chunks of information and not details.
Why do we start to lose our memory?
Well, you also walk slower as you grow older.
Everything just
and
sort
your
of
grip
slows
is not
down.
as strong. So a little bit of wear and tear comes with the aging. The good news is it doesn't have to be the case.
There's lots of discoveries that scientists are making now,
yes,
isn't
in
there?
the past 2-3 years, scientists have found that you can indeed prevent memory loss that comes with aging. So, for example, if you exercise, if your diet is rich in fruits and fish, and if you drink a glass of wine with dinner, all these things have been shown scientifically to indeed reduce risk of memory loss.
I've heard that about wine for your heart, but brain as well, a glass of wine?
Yes.
Red or white?
Yes. It turns out that what's good for your heart is good for your brain, and that shouldn't come as a surprise because they're both organs in your body. So,
well, that's good news. And your blood pressure can affect your memory. Is that right?
Yes, and that's exactly the reason. Because if you have high blood pressure over several decades, your blood vessels get narrower. That means less blood to your heart, less blood to your brain.
Okay.
So that's why lowering your blood pressure is really good for reducing risk of heart attack and also reducing your risk of developing memory loss.
B12, you were saying eating the fish, and that's for the omega, isn't it?
Yes.
But also B12 is something that's good?
Yes. So B12 is essential for your day-to-day brain function.
Yeah.
And people who, for example, alcoholics who just drink beer and chips, or elderly who have poor diet, don't have enough B12 in their diet, they develop memory loss because they have low B12.
It says here even socializing and being happy.
Yes.
Helps your memory.
A lot of people who complain of their memory, in fact, have a little bit of depression. Depression is #1 cause of memory loss. You know, when people tell me...
Depression, the #1 cause of memory loss is depression.
Exactly. When people tell me, you know, I forget things all the time, I can't even think of, you know, the most obvious things, I forget my home phone number. And if you listen to them a little bit longer, they also say, you know, I'm really fat. To be honest with you, I really need to use...
They've got something else going on they don't feel good about.
Going on, and they're depressed. Now, there are medications that can help, and also realizing that what they have is not serious. Often, I think people who read my book tell me, after reading it, I feel more comfortable with a little bit of forgetfulness and the fact that I can do things about it. You know, I have a list of 10 things people can do. The blood pressure is one thing, lowering cholesterol is another thing, socializing is another thing, and there are other things as well.
All right, what's the one thing we should be doing today, do you think, if you want to? And once you start to lose your memory, can you recover it?
Yes. See, you don't really lose the brain parts for your memory. It's just that those parts don't function well. The structure is there, you're just not using it effectively. So being happy, I think, is one of the best things you can do. Not worrying about memory, have a good diet, stay physically, mentally active, and just enjoy life.
Well, it's good advice for everything, I think. Dr. Majid Fotuhi, thank you so much. Again, it's called The Memory Cure. Thank you.
My pleasure.
Here's Janet Live-Eye.